Hello everyone. Today we learn regarding the urinary tract infection. So first of all we need to see what is urinary tract infection, and for before that we need to see the anatomy of the kidney or the urinary system. So in that two kidneys are situated, then ureter, two ureter, then one bladder and the one urethra. Moving on to the next. So urinary tract infection. So it is an infection in any part of the urinary system like kidney, ureter, bladder and the urethra. So that will be affected any part of the urinary system. Either it may be a kidney, either it may be a ureter or the urethra or the bladder. So most infection involve the lower urinary tract infection, the bladder and the urethra. Most of the affected lower urinary tract, that is the bladder and the urethra. So the urethra that will be included into the bladder or the transfer into the bladder. Women are at greater risk of developing a UTI than are the men. Okay, so infection limited to the bladder can be painful and annoying. However, serious consequences can occur if a UTI spreads to the kidney. Okay, so women are the greater risk for the developing the UTIs than the men. Types of the urinary tract infection. So in that parts of urinary tract affected. So based on that, these all are the signs and symptoms. So first is the kidney. That is the acute polynephritis. So in the sign and symptoms, that is the if the person may having the fever, high fever, then the shaking and chills, then with that nausea and the vomiting and the upper back and side pain also occurs. So these all are the sign and symptoms for the polynephritis. Then bladder cyst, that is the cystitis. If the infection occur into the bladder, so that is called the cystitis. So in that pelvic pressure, the person may feel the pelvic pressure, then the lower abdominal discomfort. The women are having discomfort like into the lower abdomen, then frequent urination, then the painful urination, then the blood present into the urine. Then urethra, that is the urethritis. So in that burning with the urination and the discharge, white discharge also occur. Which are the causes? So urinary tract infection typically occurs when bacteria enters the urinary tract through urethra and begin to multiply in the bladder. So already I said that before, that is the from the urethra that begins and they multiply into the bladder. Although the urinary system is designed to keep out such microscopic invaders, this discomfort, these defenses sometimes fail. The most common UTIs occurs mainly in women and affect the bladder and the urethra. So infection of the bladder, that is called the cystitis. This type of the UTI is usually caused by the Escherichia coli, that is E. coli, a type of bacteria commonly found in the GI tract. However, sometimes the other bacteria are also responsible to the for the occurrence of the infection of the bladder. Then sexual intercourse may lead to the cystitis, but but the patient or the person doesn't have to be sexually active to develop it. All women are at risk of cystitis because of their anatomy, especially the short distance from the urethra and the anus. Urethra to anus, we have the women having the short distance, so due to that the spreading of the infection occur. Urethral opening to the bladder. Infection of the urethra, that is called urethritis. This type of UTI can occur when GA bacteria spread from the anus to the urethra. Also, because of female urethra is close to vagina, sexually transmitted infections such as herpes, gonorrhea, chlamydia, mycoplasma can cause the urethritis. Then risk factors. So which all are the risk factors that occurs the UTIs. So in that female anatomy, so based on the anatomy, already I said shorten your urethra. So due to that also the bacteria enters or the travels and they reach to the bladder. Then sexually active activity. Sexually active women have more UTIs than do women who are not sexually active. Having a new sexual partner also the risk increase the risk of the UTI. Certain types of the birth controls, that is the women who are using the diaphragms for the birth control may be high risk for that, as well as the women who use the spermicide agents. These are the then menopause. After menopause, a decline in the in circulating estrogen causes the changes in the UTI urinary tract, make more vulnerable to infection. Then other risk factors for the UTIs includes the urinary tract abnormalities. Baby born with UTI, urinary tract.
The other risk factors include the urinary tract abnormalities. The baby born with urinary tract abnormalities that doesn't allow urine to leave the body normally or cause the urine to back up in the urethra have an increased risk factor for the UTI. Okay, so due to the abnormalities, the babies cannot be passed the urine. So due to that, the backup flow of the urine that will be goes into the urethra. So that will lead to the increase the risk of the UTIs. Then the blockage in the urethra due to the any stones and due to the any trap. So due to that the any type of the blockage occurs. So in that kidney stones or an enlarged prostate can trap urine in the bladder and increase the risk of the UTIs. So due to this the UTIs occur. A suppressed immune system, so due to the diabetes and the other diseases that impact the immune system, so that also occurs the UTIs, increase the risk of the UTIs. And the catheter use, so prolong the use of the catheter, that also risk for the UTIs. People who cannot urinate on their own and use the tube like catheter to urinate have increased the risk of the UTIs. This may include the people who are hospitalized, people with neurological problems that makes it difficult to control their abilities to urinate, and people who are paralyzed. So these all are the catheter uses due to the UTI occur. Recent urinary procedures. Urinary surgeries or an exam of the urinary tract that involves the medical instruments can both increase the risk of the developing UTI, that is urinary tract infection. So due to the instruments that also cause the UTIs. Then next, signs symptoms. Which are the signs and symptoms? So a strong persistent urge to urinate, a burning sensation when the urinating. Person have urinating that time feel the burning sensation. Then passing frequent but small amount of the urinate. Small continuously small amount urinate will be occur. Then urine that appears cloudy, then urine that appears red, bright pink or cola colored, a sign of the blood in the urine. That will be a sign of the present the blood into the urine. Then the strong smelling urine, due to that pelvic pain in the woman, especially in the center of the pelvis and around the area of the pubic bone. So these all are the signs and symptoms for that diagnostic test. So analyzing a urinary sample. So due to that, the doctor may ask for a urine sample for lab analysis to look up for the white blood cell, red blood cell, or the bacteria. So which type of the bacteria will be present, and if any white blood cell or if the blood present into the urine. So these all are the we can identify from the urine sample. To avoid the potential contamination of the sample, the patient may have been instructed to first wipe the genital area with an antiseptic pad and to collect the urine midstream. First, we need to take which type of the urine. So first, we need to urinate some amount of the urine. After that, midstream of the urine we need to collect, and before that, we need to wipe the genital area with the antiseptic paste. Then the crowning urinary tract bacteria in the lab. Lab analysis of the urine is sometimes followed by a urine culture. This test tells the doctors what bacteria are causing your infection and which medication will be most effective. Then creating images of urinary tract. So if the patient having frequent infection, the doctors may think that will be caused by abnormalities in the urinary tract, or they have the ultrasound, then the CT scan, MRI. So due to that, if the frequently infection occurs, so for that we need to identify perfectly. So for that we need to done the CT scan or the MRI or the ultrasound. Then using a scope to see inside your bladder. If the person having recurrent UTIs, doctors may perform a cystoscopy using a long, thin tube with a lens, that is cystoscope, to see inside the urethra and the bladder. So due to that, we can identify the which are the affected parts. Then prevention, how you need to prevent. So drinking the plenty of liquids, especially water. So you need to drink the 3 to 4 liters per day. That will help to dilate the urine and ensure that will be urinate more frequently. Then allow the bacteria to be flushed up from the urinary tract before an infection can begin. So starting the infection, so before that, that will be a urinate. Then drink the cranberry juice. So although the studies are cannot be conclusive that cranberry juice to prevent UTIs, it is likely not harmful. Then the uh, wipe from front to back. So you need to wipe the front to back, not to back to the front. So doing so after urinate and after a bowel movement helps that prevent the bacteria in the anal region from spreading to vaginal and the urethra infection. Empty your bladder soon after intercourse. So also drink a full glass of water that helps to flush the bacteria after the intercourse. So that will be also you need to also the empty the bladder. Avoid potentially irritating feminine products. So if you having the any irritating like spray products, then the powders, then the touches, there, so you need to eat it from that. So you need to avoid that. Then changes your birth control method. So diaphragms or unlubricated or spermicide treatment condoms can be contribute the bacteria growth. Thank you.